So anytime you have surgery, there can be risks and complications. The most common risk is the risk of general anesthesia. However, it's a very small risk. Nowadays, our anesthesiologists and the medications we use are state-of-the-art, and the risk of a complication in a normal patient is very, very low. Now, if you're a patient and you have any history of heart disease, lung disease, or any other condition that may adversely affect your anesthesia, we'll get clearance from your heart doctor, your lung doctor, or even your primary care doctor prior to going to sleep for your surgery. So rest assured, we're going to do everything we can to make sure that your anesthesia and your surgery goes as safely as possible with minimal risk and minimal complications. Having said that though, aside from the risk of anesthesia, with every surgery there's a risk of bleeding. It's very low. It's usually less than 1%. There's also a risk of infection. This too is very low. Even if we have to put mesh in a hernia repair, the risk of infection is less than 1%. One of the biggest concerns patients have is after surgery, how much pain will I be in? And while we don't consider that a complication, pain after surgery can become a complication. Most patients will be on pain medication for anywhere from 3 to 5 days after surgery. I have some patients who take every pain pill I give them after surgery. I have others who don't. They take a pain pill or two and then switch to Advil, Motrin, or Aleve. The bottom line is everybody's different when it comes to pain after surgery. But rest assured, we'll be there to help you and do everything we can to minimize your pain and make the experience as positive as we can for you.